The European Society for Cardiology actually did some great work on trying to classify cardiomyopathies, which could be actually be commendable. So they tried to classify cardiomyopathies, and how they did it is like this. Okay, they tried to like list the types of cardiomyopathies out. Okay, and they also tried to group them if the cause of the cardiomyopathies is from the genes, like a genetic cause, or if it is not a genetic cause. Genetic cause means that okay, this was inherited and all the stuff, right? Non-genetic cause could be that it is idiopathic. You don't really know what is causing it, right? Then it could also be that there's another underlying disease condition triggering that. Okay, so yes, there's a category like this. So each of these categories, you get to see if is it genes or is it not genes. Do you understand? Like this is the categories, but each of them now, when you talk about each of them, you get to ask questions like how far is this in a family link stuff, or it is actually just from some disease conditions that are resulting to this, or you say that is this is the cause not known. Okay, so let's look at the categories, then we'll look at the subcategories. So for the categories, we have cardiomyopathy classified into what? Hypertrophic cardiomyopathy, which is usually when, wow, I didn't bring a picture that has everything, but this is hypertrophic. Hypertrophic is usually what? The muscle of the heart itself is getting large. Dilated cardiomyopathy, this one, the muscle size is still the same thing, okay? But the heart chambers are basically becoming so large. The heart chambers are becoming large. The restrictive cardiomyopathy is more of like what? The heart muscles are normal. The heart shape is normal, but the heart cannot become elastic. You get? Then the arrhythmogenic right ventricular cardiomyopathy, which is usually inherited. This one is the problem is localized on the right ventricle, right? Then we have the what Takotsubo cardiomyopathy, which is also known as what broken heart syndrome. Okay, so we discuss all of them individually, the symptoms, the treatment, everything we'll be talking about it. Okay, so for the subcategories, it's more of like, okay, you are saying you have hypertrophic cardiomyopathy, so there's like subdivisions and all that. So when we go on, we say it. So there could be hypertrophic obstructive cardiomyopathy. That means the heart muscles are becoming enlarged. Like this is hypertrophic cardiomyopathy, right? The heart muscles are becoming thick, and this is due to what? An obstruction somewhere. There could be non-obstructive hypertrophic cardiomyopathies, which is just simply the heart muscles are getting large and the problem is not due to an obstruction, right? There could be ischemic cardiomyopathy, which is usually what? The blood supply to the heart is being cut off and all that. All right. Then there could be non-ischemic cardiomyopathies. This one, there's a problem with the heart muscles, but the problem is not from blood supply. Okay. Then infiltrative cardiomyopathy, then storage cardiomyopathy, then cardiomyopathy associated with what? Systemic disease. This one, there is what? A problem with the heart muscles, but this is secondary to an underlying systemic disease. Okay, so this classification helps to guide the diagnosis, treatment, and research, and provides a framework for understanding the diverse range of cardiomyopathies. So we'll break each one of them down. Okay, so if you want a particular video on any of these cardiomyopathies, simply just comment and I'll get it to you.